today. Could you state your name and date of birth for me? All right, Miss Bailey. All right, do you happen to have any allergies, Miss Bailey? Okay. Would you happen to be allergic to betadine, iodine, or latex? No. Okay. Well, the doctor ordered that you have a catheter inserted since you had some problems going to the bathroom. So I'm going to start this procedure by washing my hands. And I'm going to get me some clean gloves. I'm just going to clean you up a bit first. Got my gloves on. I'm going to move the covers back. I'm going to drape you with this towel for privacy, just in case someone was to happen to walk by the door or something. We don't want them to see you. I'm going to ask you to place your legs in the dorsal recumbent position. This is so that we can easily access the area. Try not to move as least as possible so we can keep it easy and won't have to start all the way over or anything. I'm going to start by cleaning front to back. Then I'm going to turn my towel the other way and I'm going to clean front to back. Alright, I'm done with your cleaning for the day. So I'm going to remove these gloves. And I'm going to start my sterile procedure. I'm going to use this bag right here for my trash bag. Place this within reach. Now I have my sterile field right here. I'm going to place this at the end of your legs. Okay. Got everything ready. So I'm going to touch the 1 inch outside border is considered contaminated, so I can touch it. And I'm going to touch it away from me. My gloves are on top, so that's going to be the start. Got my gloves. Got my gloves on. And if I was to contaminate my field, I would start the procedure completely over. So I have everything in reach now. I'm going to start by adding to my field. I'm going to put the shiny side down. And I'm going to insert this right here. Trying not to touch the patient too much, but I can touch this since I have on sterile gloves. I'm not going to touch my patient though, just yet. Now I'm gonna use this to stretch my field, and since it is a woman, I could fold it in half and leave it this way. Now, Miss Bailey, I'm gonna ask you not to move too much, okay? So we can get the procedure done. Okay, now that my field is set, I can start opening my kit. So there's that part, and here's my catheter. So I have my tweezers, my betadine, my cotton balls. So I'm going to start by adding the betadine to my cotton balls so I can clean up my patient. Throw that away. And while that is sitting, I'm going to take my lubricant and I'm going to squirt it in the cup. Got that done. Next, I'm going to insert my water syringe to my catheter. Okay, got that done. Place that in the garbage. Now I could lubricate my catheter ahead of time if I wanted to. So I'm going to sit that in my lubricant. Throw that in my trash. Now that I have all the steps out the way, I can start by cleaning my patient with my betadine cotton ball. So I'm going to go front to back on the side, throw that one away. Front to back, throw that one away. Down the middle, throw that one away. Then I'm going to go from front to back again, throw that one away, front to back again, till I use all of my cotton balls. So now I'm done with that part. So now we can get ready for insertion. My tube is already lubricated, so I'm going to use my non-dominant hand to separate the patient's labia so I can easily see where I need to go. Alrighty, so I got my stuff ready, I got my syringe connected, I got everything I need and set. So I'm going to insert my catheter. I'm gonna ask Miss Bailey to on the count of 3. We're gonna do the insertion, so you might feel a little discomfort. 1, 2, 3. So I'm gonna insert it into my patient, and I'm gonna insert 2 to 3 inches. And then once I start seeing urine return, I'm gonna insert it 2 to 3 inches more to make sure it's in all the way. Okay, it's all the way in. Now that I have it inserted, I can inflate my bubble and get all my water out. Okay, now I can disconnect this and place it in my tray with my trash. I'm going to take my bag and I'm going to place it below the level of the bladder. So I'm going to attach my catheter first to my patient's thigh, my inner thigh, and I'm going to connect the bag to the end of the bed below the level of the bladder, because if it was any higher, my urine could go back up to my patient, and I don't want to do that because I don't want any infections or anything coming from the bag. Before I get ready to clean up, I'm going to collect the specimen. My specimen is going to come from my bag. If my bag was to be sitting here an hour or more, I would collect my specimen from the port, the sterile port. So I'm getting my specimen, and that's all done. My bag is secured below the bladder. Everything is done, so now I can start my cleanup process. Got everything cleaned up and out the way. The way. Clean up my patient. The excess betadine that's left on my patient, I'm going to clean it off. I'm going to remove everything, put their clothes back, put the covers back. I'm going to document my procedure and my patient's response to the procedure. Okay. I'm going to lower the bed to the lowest position, make sure the side rails are up, and I am done with that part. Okay. Take off these gloves, throw these away. I'm going to come back later. Hi, Miss Bailey, how are you? The doctor ordered today that we can have your catheter removed, so I'm going to come in and wash my hands. I'm going to put on me some clean gloves since removing the catheter is a clean procedure, it's not sterile. Could you state your name and date of birth for me now? All right. Identify my patient. So now, I'm going to remove my patient's cover, give my patient a drape for privacy. I am going to empty my bag of urine. I'm going to remove my tape. Make sure they're in the dorsal recumbent position, of course. Remove my tape. I'm going to bring me a syringe so I could deflate my balloon before removing it. And with deflating it, you want to make sure that you get 10 mils of water back so the balloon is completely deflated. If you were to leave any water in the balloon while you're removing, the patient would of course probably cry or tell you it hurts really bad. So you want to make sure that your your balloon is completely deflated before you even try to remove the balloon. So on the count of 3, Miss Bailey, hold your breath for me. 1, 2, 3. Now I got my catheter completely out. My bag is empty, of course. So now I can clean up my patient again. Get my draping out the way. I'm gonna move the patient's, make the patient comfortable again, of course. Remove the covers. Pull the covers back, of course. I'm going to document my procedure and document my patient's response to the procedure before I leave the room. I'm gonna let the bed all the way down. I'm gonna let the side rails up, and that is all.